On average, the nation's hospitals are improving when it comes to getting certain heart attack patients the medical help they need.
But Enloe Hospital in Chico is beating the average response time by a lot, in fact. In tonight's Health Watch, Action News reporter Britt Carlson explains what they're doing and how it's helping save lives. Britt?
Alan and Kira, earlier this week a national study found that more than 90% of heart attack patients who needed emergency angioplasty got it within the recommended hour and a half after getting to the ER. That's also called the door to balloon time. Well, Enloe is cutting that time nearly in half, but with some community education, it could improve even more. It started as just another typical day at Doug Bentz's almond orchard.
I happened to be in this orchard cutting up some tree limbs, getting them out of the way in preparation for harvest. Typical burger hot lunch, French fries and hamburger.
Until he felt a strange and uncomfortable pain after eating.
After dinner, that elephant came back and sat on my chest and a vise on my arm.
After a stop at immediate care and an ambulance ride to Enloe, it was clear Bentz was having a heart attack and needed an angioplasty.
The fully evolved treatment is immediate treatment of opening the artery and putting a stent in the artery to keep it open.
Health officials recommend getting the angioplasty within 90 minutes of a heart attack, especially for STEMI patients, which can cause muscle loss. One of Enloe's best medium times for STEMI heart attack patients is just over 50. Another tool that helps Enloe reduce those door-to-balloon times are actually inside the ambulances. These electrocardiographs transmit the information that the hospital needs when the patient arrives.
They do transmit the electrocardiogram to the emergency room, and then we're ready for them. We know they're coming. We're ready to take them to the cath lab.
Now Dr. Magnuson says it's up to patients to learn more about identifying heart attack signs and getting to the hospital immediately.
Time is muscle. The sooner you can get the artery open, the less muscle is permanently damaged. It can be a matter of life or death.
That wake-up call jump-started a new lifestyle for Bentz with more walking and fewer French fries. Dr. Magnuson says they're looking at bringing the national recommendation to door-to-balloon time down to 60 minutes. For Action News, I'm Britt Carlson.